Hi, so my name is Nima Baiati. I'm the Executive Director and General Manager of Lenovo's Cybersecurity Solutions Group. So my team is responsible for ensuring and building in capabilities into our devices that address an organization's security needs, whether that's around zero trust, all the way through leveraging things like artificial intelligence. Lenovo is a Fortune 200 company. We're active in 180 different markets. We have around 75,000 employees who foster a culture of innovation, research and development, and really driving around organizational outcomes for our customers. And the role of security is critical today for IT teams, for CIOs, for CISOs, as well as boards and even CEOs, because we know that security is an enabler of business outcomes. And so from our perspective, we look at it as how can we enable our customers to be successful as they move down the road of digital transformation, as they're trying to address and meet their corporate strategy or their organizational strategy. How do capabilities and solutions around security help them be successful in doing so? Healthcare is a very, very unique vertical in that security, in many cases, when it comes to healthcare, can actually have real-world life and death ramifications. Not only are we talking about the personal information of patients, of hospital staff, of healthcare workers, but we're also talking about potentially changing patient records that can have an impact. Locking out, let's say, somebody who needs a critical surgery or a critical medical treatment, and now that hospital organization has been hit by a ransomware attack. Those have real world human ramifications when we talk about security. And so from a medical perspective, organizations really need to start looking at a couple of things. One, how can we improve the nature of healthcare and the nature of care that we give to patients, whilst ensuring patients' privacy and being able to allow collaboration between different medical professionals, right? If you have somebody who's experiencing an illness, let's say here in Dubai, but the thought leader for that particular illness happens to be, let's say, in Sweden, allowing those medical professionals to collaborate to come out with the best care for that patient, while at the same time making sure that that data and that patient information is secure, is vital. So healthcare organizations really need to start looking at the objectives of care and then building in security practices and policies and solutions throughout that journey. Zero trust is this concept, and it sounds, it doesn't sound very nice as I'm going to say this, but it's a very logical concept in that I take the approach that I don't trust anybody. If you need access to data or systems, you have to show me why, right? You've got to show the system why. You need to show the policies why you need access. So for example, in a healthcare setting, in the example that I gave, let's say we've got a patient somewhere in the world who's experiencing an illness, and the best doctor in the world for that type of treatment, let's say, is based here in Dubai. That doctor should show why they need access to that patient's records and how long they need access to that patient's record. It shouldn't be something that you open the key or open the door and that person has, forever access. So the approach of zero trust is I'm not going to give anybody access unless they have a valid reason why, and it's time bound. And so from our perspective at Lenovo, for example, we take this model and we apply it to a very critical area around device security, which is what we have called zero trust supply chain. And so what zero trust supply chain does is it enables an organization who gets a Lenovo PC like a ThinkPad to be able to actually validate that the components that went into that device are legitimate and haven't been tampered with throughout manufacturing or throughout the logistical chain. So being able to say, a component that went in at point B of manufacturing, now that I'm taking out that device and about to give it to you at point Z, I can attest to these components haven't been tampered with. And so that's a way in which at Lenovo we're applying this zero trust framework even to the way that we build and provision and enable our customers to take hold of our devices. Yeah, so as we were talking about, right, so we've got, these outcomes-based approaches that the medical industry and the healthcare industry is really driving towards, right? Things around equity in healthcare, right? Making sure that regardless of where a person is located, they have access to good healthcare. Making sure that we're able to bring together the best minds to be able to address a patient's needs. So we need to have collaboration, but at the same time we need to have security. And so as this collaboration is increasing, as patient records are all now digitized, we need to ensure that who's being given access to those records has a legitimate reason to have access to. So that's the first step. Putting in place policies at the human level around who has access and for how long. Whilst security is a technical aspect of IT, of course, there are human elements that we need to employ as well, because at the end of the day, the human is the weakest link when it comes to cybersecurity, right? We've all, unfortunately, get spammed with text messages, spammed with email messages. We all know somebody who's clicked on something that they shouldn't have clicked on and the ramifications of that. And so the human is the weakest link, unfortunately. And so we need to make sure that we have usability when it comes to security, that people can use the systems they need, have access to the systems they need, but at the same time are doing so in a secure way. So the first step is put in place policies where you're training your healthcare teams around what are the types of threats that you're going to be faced as a medical provider, as a records keeper, as a data entry analyst, as somebody in the billing department. Making sure that you have a very simple and clear-cut training methodology, and it's something that you're doing on an ongoing basis. And then putting in place the tools and capabilities to be able to grant access and to revoke access. So if somebody, again, needs access to something, they have a legitimate reason, give them access, they have a time-bound access, and then that access is taken away until or if they need it again, or if somebody else needs it again. So there are a number of tools that, for example, we at Lenovo have within our ThinkShield portfolio that can enable organizations to leverage these types of security capabilities. One of which was the Zero Trust Supply Chain solution that we have. We're the only PC OEM in the world that has this capability within our ThinkShield portfolio. Being able to leverage things like artificial intelligence, true contextual behavioral artificial intelligence, to be able to detect things like ransomware attacks. Every day we open the news and we see more and more healthcare organizations being hit by ransomware attacks. And so leveraging artificial intelligence to be able to detect ransomware attacks, prevent them, but also having the capabilities to actually roll back from a ransomware attack. These are part of, again, some of the solutions that we at Lenovo have in our ThinkShield portfolio to enable organizations who are mission-driven to have the right outcomes. Yeah, so for us, we are completely focused from a Lenovo standpoint on R&D and innovation. I mean, innovation is one of the core aspects of our DNA as a company, whether it's been around the ThinkPad, which is celebrating its 30th anniversary this year, all the way through the things that we're doing from a cybersecurity standpoint, a ThinkShield standpoint. So what we're really focused on is driving R&D and focusing on our mission of innovation to be able to bring new solutions to customers, especially as we see a very changing both a macroeconomic environment, the shifts in geopolitics, as well as the data requirements that organizations are facing, the rapid pace of technology growth, and being able to enable organizations, our customers, as they move through whatever these next 12 to 18 months hold. And so some of the things that we're really focused on are below the OS security and supply chain security. We break security down really into three holistic but intrinsic levels, where we focus on supply chain security, below OS security, and then what we call OS to cloud. And so these next 12 months for us are really going to be around driving capabilities and innovation, especially as it comes to below OS security, which is around biosecurity, firmware security. If we look over the last 18 months, we saw nearly an 80% increase in attacks targeting the BIOS and the firmware of a device. And so from our capability standpoint, we have a unique position to bring to bear our R&D and our innovation arms to be able to drive solutions around that area and really to marry that whole stack all the way from supply chain to cloud access and cloud data for our customers.